Rib-on composite restorations. The purpose of adding rib-on to a composite restoration is to restore the tooth so that it mimics the structural performance characteristics of a healthy, intact natural tooth. Rib-on mitigates the harmful effects of C-factor and helps to prevent gaps from forming in the composite resin between the rib-on and the tooth due to polymerization shrinkage. This phenomenon is demonstrated in this optical coherence tomography video from a 2020 study conducted by Dr. Alireza Sadar at the University of Washington. Preventing gap formations at this critical interface can prevent sensitivity, leakage, and recurrent caries. Rib-on restorations strengthen structurally compromised teeth and bridge cracks. This video provides an overview of the techniques. Greater detail is provided in the rib-on instruction manual. Making a Class 1 rib-on composite restoration. Smooth the internal contours. If the preparation has pronounced internal angles, consider smoothing the internal contours to create flowing and rounded internal line angles. Measure the amount of rib-on needed. Use a perio probe or other instrument to estimate the amount of rib-on that will be needed. Ideally, only one piece of rib-on will be needed to cover as much of the pulpal floor as possible and wrap onto the internal cavity walls. In some teeth, a second or third piece of rib-on might be needed to circumferentially wrap around the cavity walls. Cut the rib-on. Cut open the plastic packaging and use metal pliers to remove the rib-on. Rib-on is made from the same ultra-high molecular weight polyethylene fibers used to make bulletproof vests, and normal scissors will not cut it. Special scissors are included in the rib-on starter kits. When cutting small pieces of rib-on, the small rib-on pieces might spring away. To prevent this possible problem, hold the free end of the rib-on with metal pliers while cutting the rib-on. Place the unused rib-on back in the packaging. Fold over the end of the packaging and secure it with a paper clip. This will help maintain rib-on's indefinite shelf life. Wet the rib-on with resin. Wet the rib-on with a 4th generation unfilled enamel adhesive bonding resin. Do not wet the rib-on with a bonding resin that contains a dentin primer or self-etching component. If you do not have a suitable resin already in your office, the Rib-On Company offers the Rib-On Wetting Resin, which is an unfilled bonding resin designed to wet the rib-on fibers. Move the wetted rib-on to a dry part of the mixing pad and blot off the excess resin by gently pressing your dry gloved finger against the rib-on. Prepare the tooth for bonding. Use your preferred technique and preferred bonding resins on the teeth. Apply composite to the teeth. Apply a thin 0.5 mm thick layer of viscous, tacky, flowable composite onto the tooth. Do not cure yet. Rib-On Incorporated offers the Rib-On Securing Composite, which is a viscous, highly radio-opaque, flowable composite. Unlike a standard flowable composite, Rib-On Securing Composite is tacky and will help to hold the rib-on in position prior to curing. These qualities allow for the predictable placement of the rib-on while minimizing the bond line thickness between the fibers and the surfaces of the tooth. If you do not have the Rib-On Securing Composite, use the thickest viscosity flowable composite that you have. Please note that standard flowable composites lack the tackiness to predictably hold the rib-on in position prior to curing. This can lead to voids, defects, and thick bond lines, especially at axiopulpal line angles. Place the wetted rib-on. Use instruments to closely adapt the rib-on against the tooth surfaces and press the rib-on all the way through the composite so that there is only a micro-thin layer of composite resin between the rib-on and the tooth surfaces. Take extra care to make sure there are no composite voids between the rib-on and the tooth and that the rib-on is closely bonded to the surfaces of the tooth. If additional pieces of rib-on are needed for the cavity walls, place a thin layer of the viscous, tacky, flowable composite on the walls of the cavity preparation and place the wetted rib-on within the uncured composite. Press the rib-on closely against the surfaces of the tooth. Make sure that the rib-on is 1 mm to 1.5 mm below the occlusal margin. Cure. Thoroughly cure after all the rib-on pieces are placed. Incrementally fill with composite. Build up the restoration by incrementally layering and curing composite into the preparation. Finish the restoration. Place occlusal composite, contour, and finish the restoration. Class 2 composite restorations. There are two techniques for making a rib-on Class 2 composite restoration. One technique first restores the proximal wall with composite, which will turn the Class 2 into a Class 1. This technique enables the clinician to extend the ribbon partially up the proximal wall and partially up the axial walls using the Class 1 ribbon techniques as previously shown in this video. The second technique places the ribbon on the pulpal floor and partly up the axial walls before building the proximal wall. After placing the ribbon, restore the 2, 3, or 4 surface composite as you normally would. Alternative Dr. Grant Ches technique that allows for closer and easier placement of the ribbon for teeth with irregular surfaces. Make composite pad. Place a thin strip of a sculptable hybrid, nanohybrid, or nano-filled composite on a mixing pad. Dr. Ches, who has been using this technique for over 20 years, favors dense viscosity composite for this technique instead of creamy viscosity composites. Flatten the composite with an instrument so that it is approximately 0.5 millimeters to 0.75 millimeters thick. Make this composite strip roughly the same length and width as the piece of ribbon. Place the wetted ribbon into the composite. Gently press the wetted ribbon into the flattened filled composite. Be sure to leave a layer of composite that is approximately 0.25 to 0.5 millimeters between the ribbon and the surface of the mixing pad. Cut away the excess uncured composite around the edges of the ribbon. Remove the uncured ribbon composite piece from the pad by gently sliding a thin-bladed composite instrument under it. Place the ribbon. Center the composite ribbon piece over the cavity with the composite side facing the tooth. Then press the ribbon into the preparation and adapt it to the pulpal floor and the cavity walls. Remove excess composite as it is expelled along the edges of the ribbon. With this technique, it is often possible to place a single piece of ribbon across the pulpal floor and up the proximal and axial walls. Please note that when using this Dr. Ches technique, you do not place a flowable composite on the tooth for the ribbon to be pressed into. Basic principles. Ribbon will only have a positive effect where it is placed, so cover as much of the preparation with ribbon as possible. Bond the ribbon as closely against the tooth structure as possible to minimize the bond line thickness between the fibers and the surfaces of the tooth. Thick bond lines will increase the chances of voids, defects, leakage, and sensitivity. Ribbon should be fully encased within the restoration. End the ribbon lamination 1 to 1.5 millimeters beneath the cavo surface margin. The ribbon is radiolucent. Depending on the amount of ribbon and the radial opacity of the composite used to secure the ribbon to the tooth, the restoration might appear to have porosities or voids in the radiograph. The Ribbon Company is happy to have played a role in the development of these techniques. Please contact us if you ever have any questions.